Okay, we're live. Can you tell us your name?
Yes, my name's Gail Macrae.
And you were a nurse during COVID.
I was.
So which area are we going to start at? Why don't you just start telling us what you saw as a nurse? You've heard a lot of these hospital protocol
Yes.
killings,
Well,
as we call them.
I think one of the important things about my situation is that I was working in the Bay Area of California, where we had one of the most compliant populations in the country. So we were compliant with not just the lockdowns and the masking, but also the COVID injections. So in my community, when COVID was first announced and they locked down the hospitals and they stopped the elective surgeries, our hospital completely emptied out. And this was when I really first saw that we were being lied to, because the public was being told in the news that the hospitals were full and overwhelmed, and they weren't. I had colleagues all over the state of California who worked in units all over the hospital in the acute care setting, and not once during that first year of COVID in 2020 and the winter of 2021 were our hospitals overwhelmed. I would say there was, during the winter of 2020 and 2021, when this happens every year, people come in with the flu and the hospitals fill. It happens every year. It's been doing that for the whole 12 years I've been working in the acute care setting. So it was not unusual. We were not overwhelmed, and the public was being lied to. So that really opened my eyes to the fact that there were things going on that shouldn't have been going on. And then with the rollout of the isolations, they also started the COVID protocols. And I didn't notice right away the harm of these protocols until I had to tell family members that they couldn't come to the bedside of their dying loved ones. That, to me, was a crime against humanity and a violation of my oath that I knew right away should not have been happening. We isolate people in prison. We put them in the brig when they've done something wrong to torture them. And that's what I felt like I was being forced to do when I had to tell my patients' family members when they couldn't come into the hospital to be near their dying loved ones. So that was those small kinds of violations that I was recognizing, I think really helped me accept that I needed to more critically analyze what I was being told to do and what was happening around me in the hospital. So after going through those two things at the beginning of the COVID lockdowns, it really helped me to stop and think when I was being told to do things. Like the next thing was the administration of Remdesivir. This was an experimental use authorization medication. It was the only drug that we were allowed to administer to patients who were hospitalized with COVID, and it was an antiviral. And I'd been taught in my undergrad, my bachelor's degree program for nursing, that you do not administer an antiviral more than 24 to 48 hours post-symptom onset for a viral infection. And so this medication was being given to patients who were hospitalized with COVID, usually not until between 10 and 12 days post-symptom onset. So I would ask my colleagues, why are we giving this medication? The administrators, my hospital, why are we doing this? And their eyes would glaze over. And I would say to them, we have evidence showing that the administration of antivirals more than 2 days post-symptom onset causes more harm than good. The risk-benefit analysis does not correlate. And in addition to that, this was an experimental use product. And I knew that each one of those doses was over $3,000. So that was another huge red flag. In addition to that, the next part of the COVID protocols that was so extremely disturbing to me was the fact that at the onset of hospitalization for COVID, there were a team of respiratory intensivists who went before Congress and showed them how effective high-dose steroids were for the treatment of patients who had COVID. And not only were we ignoring those recommendations for high-dose steroids, they were actually blocking it from our hospitals to use. So we have patients coming in who are being feared to death by the media. They're being isolated from their loved ones. They're having steroid treatments. So I'll say one more thing about these steroids, because this is really important. The COVID, whatever it was, virus, whatever COVID was, it caused more inflammation than we had ever seen in the hospital. So there's a lab value called CRP, and even with influenza and things like this, we had never seen the inflammatory marker of CRP jump so high as we did with COVID. So for the government and the CDC and these three-letter organizations to tell practitioners that they could not administer steroids, which is this is the best treatment for an inflammatory process, it was absolutely criminal. You can't withhold steroids for the most inflammatory disease process that humanity has ever seen. So we have isolation of patients, fear-mongering from the media, withholding steroids, and the administration of Remdesivir. Those were the things that I went to work and had to manage, where I every day felt like I was violating my oath as a practitioner. And ultimately, it wasn't until after the rollout of the shots where I just couldn't do my job anymore. So that was the next part of what I witnessed. So I, like I said earlier, worked in the Bay Area of California for an organization called Kaiser Permanente, and they have a full scope of care. Their structure is set up to where you get your primary care, your acute care, the pediatricians, all of the medications, and your vaccines, all in the same organization. So with the COVID vaccine, they were administering it at my hospital. So when in February, so they released these shots to the practitioners in January of 2021, but they didn't release it to the public until close to the end of February. So by the beginning of March, I was starting to notice that my hospital was becoming slammed. And this is unusual because we get, winter rushes. This is how the hospital works. It's dead in the summer and it's full in the winter. Like, this is the cycle. And so I started noticing in March of 21 that it was very peculiar that I was starting to get all these calls to come to work because the hospital was understaffed. And it did not stop. I was in graduate school at the time for my double nurse practitioner degree, so I would do 3 weeks at the hospital and then I'd take some time off and study for my schooling. So by June, when I went into the hospital, I was there for 3 weeks. 3 weeks from March to April, and then another 3 weeks in the middle of June to the beginning of July. And I was working nonstop. I would work doubles basically every single shift. I was getting phone calls 3 times, sometimes 4 times a day to come to work because they were so understaffed at the hospital. And then in June, my manager approached me and he said to me, "Gail, this hospital has had 3 times more admissions than we have ever had since the hospital opened their doors." So that's a 300% increase in hospitalizations directly associated to the onset of these shots. So,
do you mind me asking what you were seeing? Were you seeing heart conditions, blood clots, or were
yes.
you seeing COVID?
So, and this was actually, so during that week, it was the end of June, it was around the 28th of that month when my